Kate Tulenko is the CEO of Corvus Health, a global health firm, and I asked her about China's healthcare reforms and the addition of new drugs to fight cancer.
Well, this is certainly very exciting news, and it will save a lot of lives. Most Chinese people actually do have health insurance. 95% of Chinese have health insurance, but often it only pays for a small percentage of care, or it doesn't cover most services or drugs. And so adding more drugs, especially cancer drugs, to the covered drugs list will really improve access. And I think also as we look towards 2019, we can probably see more drugs added, more generics being produced in China as well.
This is a part of a larger medical reform, healthcare reform, because it's not just about providing basic healthcare to everybody, but the vice premier is also calling for a new system to manage and supervise funds to provide medical coverage.
I think in 2019 you'll see a lot more regulation in general. One place that regulation will occur will be in health insurance and these Medicaid funds, because there has been some fraud with people's cards being used without their permission or documents being falsified. And when money leaks out the system, that means there's less money available to actually provide people care. So that's one part of the new regulation. I think we'll also see more regulation of hospitals and other healthcare facilities. Private facilities have actually doubled in the last 6 years, and private hospitals are now 60% of the hospitals, and we're seeing increasing accidents and bad outcomes. And so I think in 2019 you'll see more regulations as far as number of nurses per patient, or what type of health worker can do which procedure, or requiring hospitals to have certain quality assurance guidelines.
And it's interesting you bring up the word regulation, because in 2018, China also saw this vaccine scandal. It also saw this gene editing experiment that got a lot of attention around the world. So could we see more regulation when it comes to those sort of things as well?
Exactly, yeah. So the world was very surprised to hear the news that a Chinese scientist had edited the genes of two twin girls so that they would actually pass those changes on to their offspring. And that actually violated Chinese ethical standards as well as global ethical standards. So I think you'll see the Chinese government working on how they can ensure this doesn't happen in the future. And then some of the other scandals of 2018 included the vaccine problem, that over 1 million doses of vaccines for children were found to be substandard. The doses had to be recalled and children had to be revaccinated. So yes, I would expect to see more regulation about improving the quality of vaccines and drugs.
Yeah, huge outcry there. What are you looking for in the year ahead for 2019? Something we've been tracking is family planning. China relaxed the one-child policy, and they're relaxing it even more to more than just 2 children. So what are some of the other big things you are looking for in 2019?
So certainly it'd be interesting to see how they try to expand the access of the health insurance. And there are 2 ways to do this. One is to decrease the cost to the patient, and the other is to decrease the actual cost of care. And so that will be driving efficiency, for example, maybe through telemedicine, or maybe reducing the cost of drugs via bringing in more generic drugs. So that should be very interesting to see. Also, I'm interested in watching what happens on the ethical level regarding the twins and genetic engineering in China.
Right, because they're only getting older. We'll have to see how they develop as well. Kate Tulenko, thank you so much for joining us.
Thank you.